Prediabetes is a medical condition that occurs due to the failure of the body to produce the insulin it needs, even in times of need. There are many prediabetes risk factors. These risk factors can lead to the person having high blood sugar levels and therefore developing this type of diabetes. If you have a family history of diabetes, or if you have other relatives who have diabetes, then your chances of getting prediabetes are increased. A person with prediabetes also tends to suffer from frequent urination, and this leads to a situation where there is an increase in the production of urine, which in turn tends to produce more glucose in the bloodstream, and this can lead to diabetic shock. Prediabetes risk factors. The prediabetes risk factors can also include being overweight or obese, being physically inactive, drinking too much alcohol, smoking, having a history of having infections in the urinary tract or gastrointestinal tract, and also being a woman. Overweight people tend to have insulin-resistant tissue in their bodies, and these cells tend to release the wrong amount of glucose in the bloodstream, and this can lead to diabetic shock when the body cannot process and break down the excess glucose that is released. A person with prediabetes also tends to be very overweight and so may have reduced muscle mass. The obese person tends to become inactive, and this causes the pancreas to weaken and to work less efficiently, and also has other serious health implications. The symptoms of diabetes can also occur along with other related conditions such as hypoglycemia and hypertension. The other serious consequence of prediabetes risk factors is type 2 diabetes. When the pancreas does not work properly, it can actually damage the cells around it, and this leads to the insulin not being able to work properly, which is what is needed to keep the glucose levels of the bloodstream at healthy levels. The damage to the cells can cause blindness, heart problems, stroke, and may also eventually lead to type 2 diabetes. If you have prediabetes, then you are also at risk of type 2 diabetes, so taking steps to correct this type of risk factor will help to slow down the progression of diabetes. There are many different things that you can do to try and prevent type 2 diabetes, and one of the best is to lose weight, as this can help to keep your blood glucose levels more normal. Click the link below the video to reverse diabetes.